Ladies, let's talk. Are you pregnant and vomiting in your pregnancy is literally driving you insane? So much so that you're struggling to keep the bare minimum, even water. You are struggling to keep water down. This video is for you. Hi, Dr. Kady, right here on HeyDoc. I am a board certified family doctor. On this channel, I talk about women's health matters, fertility issues, as well as addressing pregnancy related topics. If you've been pregnant before, you will know that nausea and vomiting in pregnancy can be a real bother. And if you've never been pregnant and you've just found out that you are pregnant or you are looking forward to getting pregnant, this video will prepare you for what's to come ahead. Now, when we talk about vomiting in pregnancy, it's important to make the distinction between the two different types of vomiting in pregnancy that exist. There is nausea and vomiting in pregnancy, and there is Hyperemesis gravidarum. Yes, in both types, vomiting occurs, but let me define what the difference is between the two. In nausea and vomiting in pregnancy, you have a woman who is just pregnant and she feels nauseous, not necessarily vomiting, although it can happen. She can vomit, and she goes and sees her doctor, who gives her an antiemetic, and that's an anti-vomiting drug, and that's the end of that. She's able to keep the drug down, and that allows her to eat, that allows her to drink, and she's able to go about her day-to-day activity. Hyperemesis gravidarum, on the other hand, this happens when, despite the pregnant woman having gone to see her doctor, having had the anti-sickness drug, she's still not able to keep, number one, the drug itself down, talk less of fluids and food. In Hyperemesis gravidarum, not only does it persist, but it goes on for a long period of time. And what will tend to happen with time is that the woman can start losing weight. So it is defined as Hyperemesis gravidarum once the woman starts losing 5% of her original weight. She becomes clinically dehydrated, and if you are lucky enough to come across a good doctor, your doctor should be doing blood tests. And the result of your blood test will show that the different elements that are supposed to be in your blood starts to become out of balance. So you get what we doctors call an electrolyte imbalance. So if you have these three elements happening whilst you're pregnant and you are experiencing excessive vomiting, you should then be diagnosed with Hyperemesis gravidarum, which of course is much more challenging to manage in comparison to nausea and vomiting in pregnancy. Remember, there are two different diagnoses. What causes the nausea and vomiting in pregnancy? Well, it's not exactly known, but studies have looked at the possibility of nausea and vomiting happening in pregnancy as a result of the release of the hormone known as HCG from the placenta that is forming early on in the pregnancy. So this hormonal shift and this hormonal balance is thought to be the cause for the nausea and vomiting that is seen early on in the pregnancy. That being said, over decades and centuries, it has been observed that Hyperemesis gravidarum tends to happen in women who are pregnant with multiple fetuses. So those who have twins, triplets, there is a greater risk of Hyperemesis gravidarum in these women. Why? Because you have multiple placentas which are releasing a greater amount of HCG. Now, wait a minute. Does it mean that nausea and excessive vomiting in pregnancy is due to the fact that she's pregnant? No. Not necessarily. Now, look, ladies, your doctor should only be diagnosing you with either nausea and vomiting in pregnancy or Hyperemesis gravidarum after ruling out other possible causes for these symptoms that you experience. So, in other words, what I'm saying is, it's not because you have fallen pregnant that automatically, because you are having excessive nausea and excessive vomiting in pregnancy, that he or she should be saying, oh, you're pregnant, and of course, this is just going to be because of the pregnancy. No, that should not be happening. Why?